The Ministry of Health faced tough scrutiny over a 98% increase in its proposed 2025-26 budget, as outlined in the Budget Policy Statement. Health CS Deborah Baraza and her permanent secretaries appeared before the Senate Health Committee to justify their request. As Emily Chebet reports, Senators directed the ministry to prioritize the absorption of striking UHC staff and on permanent and pensionable terms.
Two state departments under the Ministry of Health appeared before the Senator Jackson Mandago-led committee to defend their revised budget estimates, which have surged by over 90% compared to the 2024-2025 budget. The Medical Services State Department under PS Harry Kimtai says while they require 465 billion, they have only been allocated 172 billion Kenya shillings.
This comprises of 145.1 billion in recurrent and Kenya shillings 27.5 billion in development. The overall funding gap to the State Department share, which of enumerated here, stands at Kenya shillings 254.2 billion. And Chair, I think that is what we expect if we are to operate optimally with everything that we need to undertake.
Previously, it was the budget of SHA was not included in our budget. It was an AGA. They were not getting a portion. They were not in our budget. They have been domesticated for the first time in the budget. So that brought a growth of 76 billion.
The committee questioned the sharp increase in the request in the ministry's budget, noting that in the previous financial year, they received 91 billion Kenya shillings. Senators questioned why certain ministry functions remained national instead of being devolved to counties.
Your argument is that you have so many presidential functions, but those functions are actually not your constitutional obligation. They are for county governments. Why not send that money to county government for them to be able to build their health facilities?
The list you have submitted as a presidential directive is nowhere in the budget. And therefore, as is, you have no intention of actualizing.
The State Department for Public Health and Professional Standards struggled to justify an additional 652 million Kenya shillings, citing it as a funding for community health promoters' salaries.
Community health promoters at the rate of 2,500 each, and additional for administration.
So if my mathematics is right, in a year it's 30,000 shillings. If you multiply 30,000 by 8,000 additional workers, gives you 240 million. So the administrative cost to it is more than 100%. Because then if you say 652 minus 240, you get almost 400 million for administrative to administer 8,000 workers.
The ministry struggled to address the UHC strike as senators questioned why some staff were made permanent and pensionable while others remained on temporary contracts despite having identical COVID-19 hires.
We want to see the budget of the next financial year, money for confirmation of UHC staff. We are not willing to take anything less than that. The reason we have not been able to pay is when we always say we are discussing and we are not putting on the budget, then it means we are not willing. We are just playing games with the health workers.
Even as the Ministry of Health defended their budget estimates, the committee took them to task to explain what they have termed as wastage and misplaced priorities. The Mandago-led committee wants the Ministry of Health to absorb all the UHC staff under permanent and pensionable. Emily Chebet, Citizen TV at the Parliament Buildings, Nairobi.